There are lots of common misconceptions about epilepsy. I just wanted to touch on a few. Some people think that if they're having a seizure or if they're witnessing someone having a seizure, they're fearful that they can swallow their tongue. And the fact of it is that you can't physically, it's impossible to swallow your tongue. Similar one is that you should force something in the mouth of someone having a seizure. And that's absolutely something that you shouldn't do. You can cause trauma to yourself with your fingers or your hands if you're trying to put something in someone's mouth. You could chip the tooth of the person actually having a seizure, or in some cases even break a person's jaw. For both of those misconceptions, it is important though to know that sometimes seizures can cause vomiting. And so if you see somebody who's having a seizure and if they're unconscious and on the floor, it's important to try to help gently roll them to their side so that they don't aspirate. Another common misconception is that only kids get epilepsy. And in fact, it is very common in people over the age of 65, almost just as common as in kids. Another misconception is that epilepsy is really rare. And in fact, 1 in 10 people will experience some sort of seizure in their lifetime, and 1 in 26 may develop epilepsy, which, if you remember from the previous video, is 2 or more seizures. I think it's also important to clarify a misconception that epilepsy is contagious, and it is not contagious. I'd like to also point out that not every seizure is somebody falling on the ground with all of their limbs jerking. There are many different types of seizures. It can be something as simple as taking a break in speaking, or staring off into space with your eyes fluttering, or shaking of your hand or foot, or just one side of your body, or having trouble speaking. I think it's important to get evaluated if there's any question of whether or not you're having a seizure. Something else I'd like to point out is that not everything that looks like a seizure is a seizure. There are times when an attack or a spell that somebody is having looks like a seizure, but it's not because of overfiring of electrical activity in the brain, which is the definition of a seizure. So if you have any questions, or if you have any doubts, or think that you'd like to find out more information, or if you're having spells and you're just not sure what they are, be happy to help to try to answer that question.